Okay, the next one, Dr. Wag will give. What treatments for urinary incontinence and lower urinary tract symptoms are acceptable, and what outcomes desirable to older people?
So thank you for allowing us to present our data. This is an extension of some studies which were done in midlife women several years ago by our colleague Dudley Robinson. And we wanted to extend this into older people, largely because older people have maybe lived longer with the disease, would have different attitudes and different expectations. I have no affiliations to disclose regarding this study, and I funded myself here. So we wanted to know essentially three things: what degree of improvement in incontinence older people felt was desirable, what treatments they would consider acceptable or unacceptable, and what symptoms they would put up with after they had had something done to them in order to achieve those ends. So this was a consecutive series of over 65-year-olds referred to our secondary care continence clinic. The work was done by one of our summer students, a medical student who couldn't be here, unfortunately. A validated three-part questionnaire, the Leicester Urinary Symptom Questionnaire, allowing us to make a symptomatic diagnosis, a questionnaire adapted slightly from Dudley's previous work, looking at the acceptance of current problems, their willingness to modify things, undergo various treatments, frequency of visits and acceptability of side effects, and the King's Health Questionnaire. And this was administered to 150 individuals, hypothesized to provide a robust data on the primary outcome, the degree of desired improvement. So here we are, our sample. We actually ended up with quite a variable N because of incomplete data, but 121 people overall, a predominance of females with a mean age of 70 odd years, and length of time with bladder problems, a mean of 8 years before coming to the clinic. Symptomatic diagnosis was possible in some of them. You see 26% stress, 14% urgency, and 58% mixed symptoms. Expectations, which we didn't want to interpret, we probably do, as these are actually quite reasonable. So the majority of people, half of our people, wanted a good improvement so their symptoms no longer interfered with their life. And you might think, well, actually, that's not too much to ask for, wouldn't you? And you can see the rest of the range of expectations. What treatments? Well, here we have in terms of acceptability for all of the physios and nurses in the room, pelvic floor exercises for 6 months were felt to be acceptable by 75% of older people. So why not offer the damn things? Pelvic floor exercises for the rest of their life? Less so. Drugs, intermittently, okay, but permanently, no thanks. The things that older people definitely didn't want were having to catheterize themselves and, intriguingly, surgical intervention, maybe not surprisingly. The kind of things that people would put up with, almost quite interesting, really, but never having to leak no matter what you do. Yeah, okay, that wasn't very acceptable for most people. And you can see a whole range of things in terms of acceptability. But largely, people wanted minimal symptoms in line with their expectations. And that was true regardless, in a way, of the things they would go through to get there. So women were more accepting of small leaks on sneezing or coughing and on strenuous exercise and having to wear pads than men, not surprisingly. And there was no statistically significant association between quality of life and acceptability of different treatment types, acceptability of outcomes, or expectations of cure. People, we felt in this study, were realistic in their expectations of cure, similar to previously reported in middle-aged women with overactive bladder and prolapse. People with the longest duration of symptoms were more likely to go the whole mile to achieve what they wanted, and what they wanted was any improvement, no matter how small, than those with problems of a lesser duration, regardless of the associated impact on quality of life. Frequent pad use, intriguingly, was viewed as unacceptable by patients, regardless of their UI impact on quality of life. And we've heard something about quality of life and pads earlier. Thank you very much. These are the fundings from the Glenrose Rehabilitation Hospital Foundation, for which we are grateful. Thank you.
Any questions? You know, I have one, Adrian. It's just, again, you see, patients don't necessarily want a cure. They will accept whatever just to improve.
Yeah, well, I think, yes, half of them wanted to get on with their lives and not be affected, and that's not an unreasonable expectation, we felt. So did this light any academic fires? No, but interesting information, and allows us to counsel people.
Hi, Robin from Australia. Did you talk to patients' carers and partners as well as patients?
So this was against Dr. Hunter's better judgment, not a mixed method study, and we really would like therefore to do a mixed method study involving caregivers where relevant, and that will be the next step with these data.
Hi, Adrian. Sorry, thank you. That was really interesting. I know you think it doesn't set the world alight, but I still think it's extremely interesting, useful information.
We don't do crap at our place, you see.
I'm sorry?
We don't do crap at our place.
No, of course you don't. I must have missed it, I don't know. But was this cross-sectional? Did you get any sense that... Sorry, go on.
So this was a consecutive series of newly referred patients to our Continence clinic.
Right.
So some biases, obviously, because they'd have to got through various barriers to get to us.
Right. Okay, so you've no sense that these expectations may have changed over a period of time?
So it was over a single year, and
Right.
no.
Yes.
But that would be an interesting one, wouldn't it? Because the cohort data for generations suspect that people like you or I, the baby boomers in the room, are far more demanding of their healthcare services than, say, people post-war. And if we were longitudinal enough, I'm sure we'd see that.
But absolutely, and also, is there the expectation I'm getting older, I'm going to be incontinent? Can I realistically expect that?
Yeah, how does this tie with this idea that older women think incontinence is normal for getting old? Or usual, we need to sort that one out. How accepting? I think people are likely to be less accepting as we get older.
Mm-hmm. Hopefully, but it does depend on how many pad adverts get put on the television and just normalise it, doesn't it?
Well, clearly, if you wear a small pad, you can start playing beach volleyball. Thank you.
Mm-hmm.